we worked with Medicare health data a few years ago, really linking hospitalizations to smoke, what we call smoke waves. So a smoke wave is 2 or more consecutive days when the levels of particulate matter, levels of smoke particles, are above some threshold, so higher levels of smoke. And they're not even that high, but still we can see an increase in the number, a significant increase in the number of hospital admissions in the wake of this smoke wave. And the levels of smoke that are currently being experienced by people in Oregon and California are truly hazardous. I mean, the EPA labels these levels as hazardous, and that is not an exaggeration. While the US has done a tremendous amount to clear the air in California and in other very populous regions, such as New York, the Mid-Atlantic states, we've made those changes in air quality through EPA regulations on emissions from factories or cars. But what we cannot so easily control is how fires respond to changing climate. So what we call this is the climate penalty on air quality. So while we're working so hard to cut emissions, we cannot control so easily the smoke emissions coming from these fires. And these fires are really overwhelming our efforts to clear the air. So right now, the estimate that we got was that on bad air days in the western US, 70% of the particulate matter comes from smoke. And that's just on average. So this year, the smoke is really overwhelming the air quality. We do expect to see a spike in hospitalizations this fall, and it will take some statistical sleuthing, but we could also look at death rates in the months to come.